Welcome back to Healing at Home and rectal insufflations, ozone insufflations to boost the immune system. So let's have a look shortly at some of the theory on how rectal insufflations are done and what they do, and then I'll show you in real life. Okay, first of all, it's the ozone bag that you fill with ozone, which you connect to a catheter that is then inserted into the rectum so that you can blow up all the ozone into the colon, where it's then absorbed through the mucous membrane into your bloodstream, from where it goes directly to the liver. It's very easy. It's very fast, the treatment. It's done in just about 10 minutes. It's extremely effective. We've seen that from the Cuba studies. It does exactly the same as the big autohemotherapy, but you need to do it longer to achieve the same results. But you don't need to travel to the doctor. You don't need to be poked with needles. So it's very, very easy and efficient. And it's very cheap. Once you have the equipment has a guarantee for 10,000 hours of usage. That's years. Your whole family, if you create one bag of ozone, that's about 4 minutes of ozone generation. So if you count 10,000 hours, you can do a lot of bags. It's totally safe. There is no risk involved. Can be applied 3 or 4 times per week. Some people even do it 2 times a day, morning and evening. I wouldn't overdo it. It's just a general flow and used for infections, wound healing, inflammation, and immune activation. Just see it as a general boost when you have all sorts of latent infections and all sorts of pathogens, that you slowly reduce them, you mobilize your immune system, and over time, it's not a short-term treatment, but over time you will get very, very powerful immune response and a lot faster. Now, what you need is the ozone generator, you need catheters, and you need the ozone insufflation bag, which is in the starter kit altogether. Now, I'll show you, but I'll go through the checklist because I really like checklists. Sometimes you forget. Go to the toilet first. Important. You don't want to have a full colon and then pull the plug. It's not very hygienic. It's not very nice. So go morning, toilet, and then afterwards you can do it. Fill the insufflation bag with ozone, oxygen mixture with 42 milligram per liter. That's probably the best range to do it. You can go a little bit lower in case you have a burning sensation, but you can also go a little bit higher if you feel okay. I can go up to 80 and 90 and I don't feel any burning, so I use a higher concentration. Lay on the left side and insert the catheter about 3 inches. Inches, there should be a H. Okay, open clip. You've seen that little clip. I'll show you that live then. And slowly roll up the back to blow all the ozone into the rectum. Hold for 10 minutes until the oxygen is absorbed into the blood. You know, it's like a big fart that you have up your butt and you need to hold closed. You pull the plug. Once you've blown it all in, you pull the catheter and then you sit tight. You can sit down, you can lay down. Just hold the gas in as long as you can. And once you're done, just go outside the door and squeeze and let a big fart go if necessary. Usually it's absorbed very strongly into the mucous membrane. Repeat 3 or 4 times per week. Speak with your doctor about personal conditions. Now, I've had clients that come that have a huge tumor on their rectum, you know, anal cancer, rectal cancer. They have issues, bleeding, tumors. Speak with your doctor before you do that. It's quite wise to do those things educated and well planned. Find a doctor that uses ozone and speak with them how you can use it. It's actually a very beneficial treatment, and I know in Switzerland Dr. Rao uses it with his clients. Dr. Henning, all the doctors that we spoke with use it in that area. So they use ozone directly as ozone gas for the cancer, but they also insert it into the cancer, around the cancer. They use it rectally. But I can't tell you to do that. If you have a condition like that, if it's bleeding, you need to be very, very careful. Speak with your doctor first before you do any decisions that might cause harm. And I don't want to be responsible for that. Yeah? In actual fact, I don't tell you to do that treatment. I just show you how we do it, and thousands of patients around the world do it. And if you do it yourself, then that's your decision. All right? So let's go to the table and I show you how you set the whole process up. So let's look at the practical application on how to create ozone. And let me just arrange this. The camera up here should actually take it very nice. We turn this around so that you can see the separation lines. Now, what we do is we activate oxygen flow going through the hose into the oxygen ozone regulator. Now, the most important is that you have your setting properly here on 1/4. Now, 1/4, as you can see here, is a flow that produces 42 milligram per liter concentration. So it's just perfect for rectal. If you would like to reduce that to 23, so you would take it down to 1/2. And that's a very simple process. That's how you control the speed. If we go a little bit higher, for me, I do 1/8. So it takes a little bit longer, but the concentration is stronger because the flow is slower. So let's stay with 1/4, and I would recommend you start with that. Now, all you need to do is, there is now oxygen coming out here. From the bottle, the oxygen is going through, and if you smell here, you can see oxygen is coming out. No ozone. Only when I turn the device on with this power button is it transformed into ozone. So what you can do is now, you screw on this little cap, press the button, and now the green light comes on and you hear the vent internally. Now that's when it produces ozone. Now what I do here is I hold my finger on this little break here so that I don't fill the whole bag. It's too much. It's quite a lot when you fill the whole bag. You can do it. It has a greater effect, but it's also quite intense. Now you can see it fills up the first bag, and once that is done, it squeezes into the second bag. And that means we have now about 200 milliliters full, and now it starts slowly filling up the second compartment, which is then 400 milliliters. And as soon as that is full, we'll turn off the bottle and we turn off the device. Now what you can do is actually you can already close the bottle because there is so much pressure still in the device that it still keeps filling and still oxygen keeps running, but it doesn't waste any of your oxygen in case that's important. Now you see they are both pretty full, so we fill them to the maximum, and then what you do is you let your finger go because now it deflates into the whole compartment. You turn off the device and you unscrew this little cap. Now, most importantly, close this. Now, by closing this, all the ozone stays in the bag and it's nicely separated now into the whole bag. That's safe. Now the rest, the oxygen that is still blowing from the pressure, comes out here as pure oxygen. So no danger, nothing is escaped. There is no smell of ozone here, which is the only thing you need to watch out for. And you have all the ozone in your bag. Now, how long can you use that? In 2 hours, it will have half the concentration. In 4 hours, 1/4 of the concentration. So ozone is very volatile. It doesn't last very long. So it disperses into oxygen and then you have pure oxygen back in the bag. So we want to use that as fast as possible. So what you do next is you take here your little connector, take a fresh catheter or cleanly washed catheter and screw that on tight. Now you would take this whole thing into the bathroom, insert it about 3 inches, 2 to 3 inches. You know, it's better safe than sorry. And you put it in. Then you open this little clip and then you roll up the bag. I won't do that now because then all the ozone is here in the room and we don't want to have that. But it's a very simple process. You just roll up the bag and through that you slowly do insert all the ozone into your colon. Then you pull the plug and hold tight. It's like a big fart that you want to hold as long as you can so it's absorbed through the mucous membrane into the colon. And that's all there is. Now, the next question would be, how to clean that catheter, because that's the only thing you want to keep clean so that you can use it many times over and over again. And for that, you take the syringe that was supplied with your device. Very simple. You fill that up with warm water, connect that to your tip, which is a perfect match, and you wash the warm water through. You can do that repeatedly. Soak up warm water, connect it, and flush it through as fast as you can. Rinse off under water with a bit of soap, and then this can last you for weeks. You know, you don't need every time a fresh catheter. If you clean it nicely and you do that with the syringe with warm water, flush it through, that it's very clean, outside clean, and that's a perfect way to reuse those catheters for a long time. We have 10 packs, so you can order always 10 packs and use them until they get a little bit yellow and dirty, and then if you want fresh ones, you can get the next pack, all right? That's pretty much all there is. Now, if you feel that you need to let go of your wind, you can go outside on the balcony, stretch out your butt and let the air escape. And there is no danger, no problem to anything, because it instantly turns into oxygen. The volatile, reactive part of ozone instantly returns into oxygen, so there is no harm to the environment, there is no harm to you, and you've absorbed that extreme immune boosting element into your body, all right? And now go on to our next video where we talk about ear infections, where you learn how to use ozone at home for your ears.